The thyroid is an endocrine gland that secretes thyroid hormones. Increased production of thyroid hormones gives rise to hyperthyroidism, also called thyrotoxicosis. The commonest cause of thyrotoxicosis in the young is Graves' disease. Decreased production of thyroid hormones gives rise to hypothyroidism. Myxedema is the severe form of hypothyroidism. Examination of the thyroid involves examination of, number 1, general examination, number 2, examination of the hands, number 3, face and eyes, number 4, the thyroid gland in the neck, number 5, proximal myopathy, number 6, pretubular myxedema, and number 7, the reflexes. During examination, there will be a chaperone. I shall now wash my hands. General inspection. General inspection begins as patient enters the room. Observe the movements, whether they are brisk and fast, and whether the patient is nervous looking, as in hyperthyroidism, or whether the movements are slow and lethargic, and the patient depressed looking, as in hypothyroidism. Hello. Good morning.
Good morning.
Please do have a seat. My name is Dr. Lim. May I know your name?
I'm Jenny.
May I call you Jenny?
Yes.
Hi, Jenny. How are you today?
I'm good.
I would like to do a physical examination on you. May I have your permission?
Yes.
Observe the patient. Observe the voice. Whether the voice is high-pitched and thin, as in hyperthyroidism, or whether it is coarse and slow and low-pitched, as in hypothyroidism. Observe the general demeanor, whether the patient is fidgety, restless, and agitated, as in hyperthyroidism, or whether she's slow and lethargic, as in hypothyroidism. Observe generally whether she is thin, as in hyperthyroidism, or whether she is puffed up and bloated, as in hypothyroidism. Examination of the hands. Jenny, can you please put up your hands? Let me have a look at your hands. Look at the skin to see whether it is thin and fine, as in hyperthyroidism, or whether it is coarse and thick, as in hypothyroidism. Look at the palms. Feel whether it is warm and moist, as in hyperthyroidism, or whether it is cold and dry, as in hypothyroidism. Look for acropathy. Next, take the pulse. Count the rate, whether there is tachycardia, as in hyperthyroidism, or whether there is bradycardia, as in hypothyroidism. In hyperthyroidism, the pulse is bounding. whereas in hypothyroidism, the pulse is low volume. Also look for the rhythm, whether it is irregular, as in atrial fibrillation, which may be present in hyperthyroidism. Next, we shall examine for fine tremors. Jenny, can you please put out your hands? We shall put a piece of paper on it so that any fine tremors can be seen more clearly. Look for fine tremors at eye level. In Jenny, it is normal. In hyperthyroidism, there may be fine tremors. Examination of the face. Look at the face. Examine the face to see whether it is thin with a staring appearance, as in hyperthyroidism, or whether the face is puffed up with periorbital swelling and thinning of the hair on the scalp and on the lateral part of the eyebrow. The tongue may be enlarged in hypothyroidism. Jenny, can you please put out your tongue? Next, we examine the eyes. For the eyes, we look for, number 1, exophthalmos, number 2, lid retraction, number 3, lid lag, and number 4, ophthalmoplegia. Now we look for exophthalmos. Exophthalmos means protrusion of the eyeball beyond the brow. First, look from the side and look from the above the head and over the brow. If the eyeball protrudes beyond the brow, it means exophthalmos is present. Exophthalmos may be present in Graves' disease, lid retraction, and lid lag. Lid retraction can be detected just on inspection of the eyes. Observe whether the white of the eye can be seen between the upper eyelids and the black of the eye. If the white of the eye can be seen, it means the lid is retracted or pulled back, showing the white of the eye. That means lid retraction is present. It may be found in hyperthyroidism. I shall now demonstrate examination for lid lag. First, the instruction. Jenny, can you please follow my finger without moving your head? Move the finger downwards and observe the movements of the upper eyelids in relation to the downward movements of the eyeballs. If during the downward movement, the white of the eye can be seen, that means the upper eyelid is lagging behind or slower, cannot catch up with the downward movements of the eyeballs. That means lid lag is present. It may be found in hyperthyroidism. Ophthalmoplegia means weakness of the extraocular muscles of the eyes. Examination for ophthalmoplegia can be done by doing an H test, so called because the letter H is drawn in front of the patient as will be shown. Look for ptosis and strabismus. First, the instruction. Now, Jenny, I want you to follow my finger and remember, do not move your head. All right? Can you see my finger? Follow it. Look for nystagmus. While drawing the edge, observe the eyeballs' movements, whether they are full range and to the maximum and so symmetrical, or whether the movements are not symmetrical with one side moving less and not to the maximum. Now we look for diplopia. Jenny, how many fingers do you see? One. How many fingers do you see? One. How many fingers do you see? How many fingers do you see? One. How many fingers do you see? One. How many fingers do you see? One. The thyroid gland consists of right and left lobes and a central isthmus. It is situated on the anterior aspect of the neck, medial to the sternocleidomastoid muscle, below the thyroid and cricoid cartilage, on either side of the trachea, with the isthmus across the second tracheal rings. It is ensheathed by the pretracheal fascia onto the trachea, such that when the patient swallows, the larynx and trachea moves up and the thyroid gland moves up with it. That means the thyroid gland moves up with swallowing. Now I shall demonstrate the surface anatomy of the thyroid gland on the patient. The thyroid gland is situated on the anterior aspect of the neck, medial to the sternocleidomastoid muscle, below the thyroid and cricoid cartilage, on either side of the trachea, with the isthmus across the second tracheal rings. I shall now demonstrate examination of the thyroid gland. Examination of the thyroid gland involves 1. Inspection, 2. Palpation, 3. Percussion for retrosternal goiter, and 4. Auscultation. Jenny, I would like to have a look at your neck. Is it all right with you? Make sure if the patient has a collar to open the collar and make sure the neck can be properly seen. Inspection should be done from the side and from the front. Look for any mass or swelling, any scars, for example, thyroidectomy scar. Look for any dilated veins which may be present in retrosternal goiter, which may cause thoracic outlet obstruction. Look for any redness. If a mass is visible, ask the patient to swallow. Jenny, can you please swallow? If the patient's mouth is not dry, she can swallow her own saliva. However, if the throat is dry, offer her a sip of water. Jenny, would you like to have a sip of water? Swallow. Observe whether the mass moves upwards with swallowing. If it does, it is a thyroid mass. Next, palpation. Jenny, I would like to feel your neck. Is it all right with you? Is there any pain in your neck? Are my hands warm enough? Examination should be done from behind the patient. The neck should be relaxed and not hyperextended so that it's easy to be able to feel for any mass. Place the hands over the thyroid gland. Using the palm of 2 to 3 fingers, use gentle rolling movements. Examine in a systematic order, first the isthmus, then the right lobes, and the left lobe. Feeling for any mass. Now ask the patient to swallow to see whether if there's any mass, whether it moves up with swallowing. Jenny, can you please swallow? If patient's mouth is dry, then offer patient a sip of water. Jenny, can you just sip this and swallow? While swallowing, feel whether the mass moves upwards with swallowing and also the lower border. If the lower border is palpable, that means there is no retrosternal extension. If a mass is palpable, examine and report as follows: whether it is diffusely enlarged all over the thyroid, or whether it is a discrete nodule, singular or multiple. Identify the location, whether it is at the isthmus, or the right lobe, or left lobe, upper or lower area. Feel for the consistency, whether it is soft, firm, or hard. Feel the surface, whether the surface is smooth or whether it is rough and irregular. Feel the margin, whether it is well defined or irregular margin. Feel for any warmth or tenderness. Jenny, is there any pain? No. And look for mobility. First, hold the mass between 2 fingers and move it over the underlying tissue to see whether it's mobile. Pinch the skin over the mass and move it over the mass. If it's movable, that means it's mobile. If it's not movable, that means it is fixed. Any enlargement of the thyroid gland is called a goiter. Auscultation. Auscultation is done by placing the stethoscope on the 2 lobes and the isthmus of the thyroid gland and to listen for a bruit. The patient should be instructed to breathe in and out and hold the breath so that a soft bruit can be detected and not masked by the breath sounds in the trachea, as will be shown. Jenny, I'm going to put this on your neck just to listen. Is it all right with you? Can you please breathe in and out? In, out, a few times. Breathe in. Hold it, all right? listen for a bruit. A bruit sounds like this. A bruit may be heard in hyperthyroidism, which indicates increased blood flow to the thyroid gland. Now we look for proximal myopathy. Proximal myopathy is weakness of the proximal muscles of the limb. We will now look for it in the lower limbs. Jenny, can you please stand up and sit down a few times? If patient has difficulty in getting up from the sitting position, that means there's weakness of the proximal muscles. Proximal myopathy is more common in hyperthyroidism. Look for pre-tibial myxedema. Look at the lower part of the leg for any swelling. Press over the lower part of the shin for 10 to 15 seconds. And look for any pitting. In pre-tibial myxedema, there will be minimal pitting, so-called non-pitting edema. The reflexes are affected in hyperthyroidism and in hypothyroidism. I shall now demonstrate the biceps jerk. I shall tap the biceps tendon with a tendon hammer and observe the contraction of the biceps muscle and the jerk in the forearm. Jenny, I shall just lightly tap this on your hand. Is it all right? Just relax. In hyperthyroidism, there is hyperreflexia. In hypothyroidism, there is hyporeflexia, where the contraction phase is normal, but the relaxation phase is slow and delayed. I shall now do the ankle jerk. In summary, I would now like to highlight the important aspects in the examination of the thyroid. Firstly, examine for the general appearance and general demeanor. Secondly, examine the hands. Thirdly, examine the face. Fourthly, examine the eyes for exophthalmos, lid retraction, lid lag, and ophthalmoplegia. Fifthly, examine the thyroid gland in the neck. Number 6, examine for proximal myopathy. Number 7, examine for pre-tibial myxedema. And number 8, the reflexes.